I'm Swati. I'll be presenting about the role of MRI techniques in the early detection of brain tumors. When we look at a brain tumor in MRI, are we really understanding it or just looking at it? This what made me explore the advanced MRI techniques for the brain tumor evaluation. Even though brain tumors are the most serious intracranial pathologies, the recent studies shows that around 6.4 per every 1 lakh people, there is 33% of mortality rate. So it is important for the early diagnosis and treatment planning. MRI is the modality of choice because of its high superior soft tissue contrast. In conventional MRI, we use the techniques like T1, T2 and the flare imaging. But is conventional MRI is enough for this? Let's imagine when we look at a brain tumor in MRI, we can find the size and the location in the conventional MRI. But with the help of the advanced techniques, we know the behavior of the tumor, the vascularity, cellularity and the functions. So the conventional MRI not much able to explain about the vascularity, cellularity and the metabolism, the behavior of the tumor. That's why advanced MRI techniques are very much important. Today I am going to explain about the diffusion weighted imaging, MR perfusion and the MR spectroscopy. First we'll move to the diffusion weighted imaging. DWI measures the movement of the water molecules, which is also called the Brownian motion of the water molecule. In the image we can see this is a patient having the glioblastoma condition, which is a malignant tumor. In diffusion weighted we can see the hyperintense signal, and in the ADC we can see the hypointense signal. Because of the restricted diffusion, the tumor appears hyperintense in the DWI. It helps to define the cellularity of the tumor. With this we can say it is a hypercellular tumor. Next we'll move to the DSC perfusion imaging. DSC stands for the dynamic susceptibility contrast, which means we'll measure the blood flow in the brain tumor. Like a tumor, if it has to grow, it needs blood supply for it to grow, right? So we'll measure the blood flow in the tumor with the help of the parameter called RCBV, which is relative cerebral blood volume. Here in the image we can see the appearance of red color in the image, which shows us the malignancy of the tumor. The more aggressive will be the tumor, then the color of the image shows red, and the blue and the green area shows the normal tissue, medium to moderate blood flow. Next, in few tumors there is a leakage from the tumors. To find out that, we use the technique called DCE, which is dynamic contrast enhanced. We measure the leakage of the tumor with the help of this technique. The key parameter used is the K-trans. Next, the MR spectroscopy. It is important to know the metabolites. Brain consists of few metabolites: the choline, creatine, NAA, N-acetyl, aspirate. These are the key metabolites we have. And if there is an abnormality in the brain, mainly in the brain tumors, we can see the change in these ratios. In the image we can see here there's a glioblastoma. We took the spectroscopy of this particular voxel, then we can see the choline ratio is increased. For the normal brain tissue, the choline will be less and the NAA will be more. But because of the tumor, the choline is high, the choline peak is high and the NAA is less, and we can also see the lipid lactate peak, which shows the necrosis of the tissue. It helps to determine the tumor characterization. The role of radiology technologist also important. If the technology is advanced, also the technologist expertise is also important to give the best quality images. So the proper protocol selection, patient positioning and the proper selection of voxel in the particular tumor, these are all important for the radiographer to acquire the best quality images. With this, I conclude that advanced MRI techniques are really important for not just for the brain tumor, to see the functionality and the cellularity, vascularity and the metabolism of the brain tumor. These are the references I took. Thank you.